Covenant Care is in the business of taking care of people. We adopted a phrase many years ago. We are really family serving families. And what that means for us is when somebody comes into one of our facilities, they're in need. We take care of the frail elderly. We take care of people who need inpatient rehab services. And we do this in 7 states.
And the facilities operate at a local level. And so each facility across our portfolio had their own recruitment strategy. So the leadership at the facility would try to recruit their own staff, and we did that for a number of years. And we had limited success, actually. But over the last 3 or 4 years, we noticed we had an increase in turnover, especially in our leadership positions, and we felt a great need to standardize the process.
Our business is so competitive. The number of caregivers that we need, these are all people with very special talents that have an active, necessary role in fulfilling what we need to do to take care of our patients.
In our industry, it's really hard to find that specific candidate because they have to have a heart for it. You have to be in someone who has a love for our elderly people.
Turnover is expensive. When you have a vacancy in a leadership position in our business, it's harder to make sure that we have clinical outcomes that we're seeking for the patients that we serve.
We really learned that when someone applies, time is of the essence. You've got to act on that candidate. With the investment that Covenant Care made and the recruiting process, and they were willing to make that investment and create a workflow that filtered through candidates in a fast, efficient manner that they could then interview and onboard in a shorter period of time.
When I got here, they were all different. I wanted to make all the processes one coherent process so that it was more efficient and everything in the HR process worked as quickly and efficiently as possible.
We needed to move very swiftly to go from 0 to 100 miles an hour to be able to put in systems and processes to attract the right talent across the country.
We've templated our job postings so they don't have to really think about it. It's a couple of clicks, they can advertise their jobs. Once they advertise, it goes to hundreds of job posting boards without them even having to think or pay additional prices.
We wanted to simplify it so that we hone in on the key things we need from a talent acquisition standpoint, but also simplify it so that our leadership, our EDs, are able to get value out of it as well.
We can pull this information to get a better idea of what areas we're struggling in terms of where we're not getting applicants.
As we've been able to reduce our turnover in some of our key positions, such as executive director and director of nursing, when those positions are vacant, it has a big impact on our business.
At the end of the day, the most important piece is educating the buildings on the iCIMS tool and why it's important to them. This creates efficiency, builds a consistent process, and more importantly, helps retain candidates.
We're getting people in quicker than we were, and the quality of people that we're bringing on board are certainly at a higher quality because we've built in some consistencies across the board.
We worked so hard in creating a streamlined process for home health and for our skilled nursing facilities. We've worked for recruiting as well as the onboarding process, and just seeing that process just grow has just helped me grow immensely.
I am so proud of our talent acquisition team, our HR team, our operations team.
We are extremely proud of this recognition for our recruitment team. It's very, very well deserved.
They brought so much to this organization since they've come online, and to work with them, it's a privilege.